Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you. Welcome back to Between Two White Coats, and thank you for joining us. We are talking a little bit more on peptides. We have done an episode that was kind of the basics on peptides. It tells you that peptides are small chains of amino acids. They are natural, and they
How to source them
safely.
What questions you should be asking.
The good, the bad, the ugly, as to, are peptides a good or a bad thing? Well, they are excellent, but they can be bad. And so really, some of the questions you should be asking if you're interested in peptides, we addressed in that other episode. So I would strongly encourage you, if you didn't listen to that one, to circle back to it. And now we want to get a little more specific. So if you said, man, these peptides seem like a good idea, and you want to move forward, we're going to talk about some of the specific peptides, what they do, and what may be a benefit to you. And I'll throw in, some of my own personal of things that I've used or had people that I'm close with use, and some of our results that we've seen from more of an anecdotal, our personal experience, but also what we're seeing in some of our patients.
I haven't done any peptides yet. Isn't
Which
that
is
crazy?
So funny because you've been talking to me about peptides for so long.
Honestly, because some of them you have to do daily, and I just don't know that I could be that consistent, which is terrible. I would have to set an alarm on my phone.
Yes.
So I'm excited to hear yours. So.
And I did a peptide training in recent months with a dear friend, Megan of Better Health. She's a health coach. And as we were learning about all the peptides, we were so excited. And I was like, oh my gosh, there's something that does that. This is fabulous. So Megan and I were like, we're going to take this peptide and we're going to take this peptide. And then we finally decided we're going to live to be 400 on all these peptides. And I said, we're going to be like the Green Mile and the Mouse. We're just going to be hanging out forever. And we don't know how long we'll live for because we'll be on all the peptides. But it is really exciting, and it's natural and it's safe. And so, there's never really been a time where I was like, what an exciting pharmaceutical drug. I can't wait to start myself on it. But with peptides, there really is like, how do we optimize our health? There certainly is a use for peptides in treating illness and chronic conditions, and in treating symptoms where, I mentioned in the last episode, so many times we have people with chronic fatigue, fibromyalgia, a lot of different things. We don't have great treatments for that. And so the peptides help people live a better life. But also peptides have a great wellness approach. How do we optimize ourselves? How do we, as we age and our cells aren't quite what they once were, how do we help boost ourselves so that we can get a little bit more of some of these things in our system? So let's dig into the different peptides and what might be interesting to people.
The ones that we're going to talk about today are the ones that we're going to most commonly prescribe here. So this is not like an exhaustive list of peptides. So just FYI.
Yes. And there is an exhausting list of peptides. And there's a lot of stuff. And Amber and I kind of dug through, and we went and we decided what we would carry here are things we could source safely and responsibly that we knew would do no harm to our patients, get from reliable compounding pharmacies. And we also kind of went for the things that were most common. Yeah. We also kind of shied away. There are some good peptides that I think if you were with a psychiatrist in a wellness arena, there are some more geared toward mental health and other things. But we also wanted to tread lightly to make sure that we always stand strong in our roots of our medical foundation, and that we're not going to say, hey, use this peptide in place of your mental health medicines or in place of seeing your counselor. And so we also, chose to not participate in some of the peptides only because we didn't know how well it might fit into our traditional healthcare arena. And we didn't want to encourage people to not be doing what we know is proven and works, and that we need people to continue to do. So a lot of stuff is kind of geared toward wellness. It's geared toward body composition, energy, rest recovery, those kind of things. So let's jump in on some of the, and I think most of these are the ones that are very popular and that you're going to hear a lot about in the internet and other places as well.
Just FYI, we say them funny different ways.
Yeah,
because
I don't know
it's
that. I think it's tomato.
Yeah,
like
same.
I'm pretty sure I've been saying semaglutide. Other people say semaglutide.
Yeah.
I don't know which is correct. To me, it's a tomato.
So just FYI,
If they called these things Fred and Jim, I'd get it right, but they don't. And so,
and we may I may say it one way one time and one day the other way. It's the same thing.
Exactly.
It's just my Southern drawl.
Yeah, and we may pronounce it different, and so we're gonna pronounce it the way that we feel is right. Yeah. But when you Google search it and you type it in, it's gonna look the same.
Yes. So the ones that affect growth hormone. So we'll start with those.
Yeah. So a lot of the growth hormone peptides have an effect on your hypothalamic pituitary axis. That is the fancy way of saying that you have this part of your brain and it feeds this other part of your brain called the pituitary gland. Tons of hormones come from the pituitary gland and they do a lot of different things. And one of those is growth hormone. And growth hormone is this amazing thing that we have a lot of when we're young, and it is exactly what it is called, which is rare in medicine and nice. But it helps people grow. So, we talked about contraindications in the last peptide talk. And one of the things we didn't mention is the appropriate age for peptides. Yeah. But I personally am going to steer away from pediatric population. And, strictly defined, that's 17 and under. I'd have to have a real medical compelling reason to take a growing body and start adding things, because our bodies know what they're supposed to do. And typically when we're young, we have enough of these things with the exception of, diseases. And so from 18 up, we start to have less growth hormone. Growth hormone is not only important for making us tall as we're growing, but it also helps cells regenerate, and it does a lot of other excellent things. And typically young people, especially when we don't have our American diet, don't struggle with things like visceral adipose tissue, belly fat. And it's easier to build muscle when you're younger. And growth hormone does those things. It helps us burn fat, build muscle, be strong. It helps with bone growth for things like prevention of osteoporosis. And it really goes to the cellular level and helps a lot of different cells and tissues to be healthy. And so there's been a lot of talk around growth hormone for a long time. And is it safe to supplement growth hormone? And this is everything that we're going to talk about with the growth hormone peptides, really important to cycle because there's a negative feedback loop for this whole axis where if you get a lot of a hormone, then your body goes, thanks, don't need to make it. And it's going to negatively kick back to your hypothalamus and pituitary and say, don't make anymore. And so as that happens, then we're going to end up not being able to produce it ourselves. The idea is not to take something exogenously, take something that's foreign. The idea is to optimize your own body. So give yourself the little bit extra that you need while helping your body still make it at the rate of which it can. So you have to cycle on and off of these, and the cycles are important. And what we also said in the last episode is do all of this under medical direction. So we're not going to give you the details of exactly this dose and exactly this cycle, because if you're doing this correctly under medical direction, then you're going to get that. And to be honest, I don't really want to tell you how to do it yourself, because you shouldn't be doing it yourself. You should be doing it with some medical guidance. And so the growth hormone peptides, Tesmorelin is kind of the strong one. Yeah. That's one that we like to watch. And these require some labs for monitoring. Tesmorelin is FDA approved for lipodystrophy, an abnormal fat depositions that comes with HIV. And so when we looked at it and saw human growth hormone helps with where our fat goes. So the people in pharma said, okay, we're having fat go to weird places. We need to do something about that. Tesmorelin can help. And what we realized is Tesmorelin really helps get rid of the visceral belly fat. I have said for so many years to my poor patients who are like, I don't know how to lose my belly fat. I'm like losing weight. I've lost weight in all the places that I don't want to lose it, and I can't lose my belly fat. And it is hard.
Especially menopausal women. Like that's the number one complaint is
change our hormone levels and we really change where the fat
Yeah.
goes. And we want you to lose that fat first and foremost because that's the metabolically active fat, which means when we get that belly fat around our organs, it's going to mess up our insulin levels, give us metabolic disorder, give us diabetes, give us heart disease. So we need to get rid of that belly fat, but there's not a lot of options and tricks that we have to help people lose that belly fat. And I will say, always I've been an athlete growing up, and I've always, if you just looked at my arms and legs, I look like I have, I'm not overweight, but I've always struggled with belly fat. And I don't eat a lot of processed sugars and such. There's not a lot of dietary stuff that I could go, if I only did that, I'm not perfect, but
I mean, you run 5 and 10Ks.
I enjoy to burn calories and things of that sort. Now that I'm in my 50s, I'm being coached by personal trainers that I need to run less and lift more, and they're absolutely right. But I tried Tesmorelin, and I've done a cycle of Tesmorelin, and I could tell a significant difference. My son and I were swimming, and he was like, "Mom, you have abs." Well, no one's accused me of that in my life. And I would say he was being generous and kind. He probably wanted something, but
hey, we'll take the compliments
I
or we
will
can get
100% take it. But I did notice with Tesmorelin that my diet and my exercise seemed to be a lot more productive. I was definitely able to lose some of the belly fat that I think is kind of hard for me to personally lose, hard for so many people. But that's really, I think, Tesmorelin's the way that I use or recommend it for people is people when they have metabolically active belly fat. This is a great way to kind of cut back some of that metabolically active fat, which for me is huge and so important. This is sure, people should look good, and I have no issues with people feeling good when their son tells them they have abs. That is what we should do. But this is also really important medically, because that in this country, what we are dying of is heart disease, diabetes related complications, metabolic disorders. And when metabolic disorders are one of our biggest problems, we got to get rid of the belly fat. Yeah. And so we've talked about things like cryotherapy and other things that help, target that belly fat some, but Tesmorelin does it aggressively. It really works for this. And so that's probably our biggest use for this human growth hormone peptide.
And then we have Sermorelin, that's how I say it.
That's how I say it too,
okay.
Sermorelin. And other people may say it another way, and we're probably the wrong ones, but tomato. And so Sermorelin works on growth hormone, and it is not quite as powerful as Tesmorelin as far as its half-life and its downstream effects. And I think of Sermorelin really as being more kind of global and doing a little bit of a lot of things that help with our general health. I like Sermorelin more as I don't want to target just one thing. I want to make a difference in a few things. Sermorelin's really known for getting people into deep sleep better. So, we say that the 4 things that you need to be focused on in your lifestyle are stress management, nutrition, exercise or movement, and sleep. And it's so easy to say, get better sleep. Well, how? I didn't choose to get bad sleep. And so Sermorelin really helps with sleep. And Sermorelin also is a little bit of muscle building, a little bit of fat burning.
I feel like it's a maintenance.
I think so too.
I mean, you can totally use it up front and cycle. Yeah. Like if you're like, oh, I don't have as much visceral sleep, maybe I want to sleep better, or I've lost the weight that I want to, now I want to build a little bit of muscle and kind of maintain, which Tesmorelin builds muscle as well. But I think Sermorelin is more of like a maintenance.
I like Sermorelin for the people who are getting near target on GLPs and have worked hard, have lost weight, and they're like, I'm afraid I don't necessarily want to be on this GLP forever. I'm afraid I'm going to gain my weight back. And I think body composition is really important beyond weight loss. And so why don't you do a couple months of Sermorelin as you come off of your GLP and work on building muscle and keep losing fat and continue to eat right and exercise, get good sleep, and just get all your lifestyle stuff where it needs to be, so that then as you get that GLP out of your life, you may be able to succeed without it. Yeah. Weight regain from GLPs, which by the way are also peptides, happens and it happens in a lot of people. And so I think sometimes having a maintenance plan, but I like Sermorelin as a maintenance. I like Sermorelin for like the postmenopausal female who's like, I don't get as good a sleep. I feel like I'm losing muscle. I won't say that I have one specific problem. I just sort of like to optimize a few things. I'm not what I was 10 years ago. I don't love that. Yeah, I think Sermorelin's great for that person as well.
Yeah, and then we have ipamorelin, which it affects ghrelin, which is a hormone, the hunger hormone, but
a little bit different than the other two in its downstream way that it acts. And where do you use ipamorelin?
I usually use it for weight loss patients, so you can add it with a GLP-1, but you actually can add it with Sermorelin or Tesmorelin as well, because then you're fighting like two different pathways: the human growth hormone pathway and also the ghrelin pathway. So you can actually use it as a maintenance as well.
And I totally agree with you. I kind of think of ipamorelin, and ipamorelin is often stacked with CJC, and it kind of helps ipamorelin be more powerful. It helps it have a longer half-life and do more. So we only make ipamorelin available with CJC to get the maximum and best effect. And I like ipamorelin for muscle building. Yeah. You know, where Tesmorelin and Sermorelin do some of that, ipamorelin seems to really help people with muscle building. I love ipamorelin along with the GLPs because GLPs help you lose weight, but they are very non-specific about the weight loss. So you lose fat and you lose muscle. And we want you to lose fat and not lose muscle. Mm-hmm. And so if you can stack some of these along with your GLP, then you're going to be able to help your body composition as you lose weight, keep the muscle, gain the muscle, target the fat.
And you won't look flabby.
Yes.
The flabbiness.
Yes. And so a lot of times when people are having this rapid weight loss, whether it's natural, post-bariatric surgery, or GLPs, then they're like, why does my tricep hang down to my waist now? What's going on there? And so it helps with the toning. It helps to build the muscle. And when you're adding exercise in as part of your lifestyle program, but you're not seeing what you want to, postmenopausal females, this is like, I'm working out all the time. Where's the muscle? I think ipamorelin is a great way to get great results out of your lifting weights and exercising and those types of things. So Tesmorelin, I kind of group as that you really want to cut the fat, especially the visceral fat. Ipamorelin, you really want to build the muscle, target the muscle. Sermorelin, more maintenance, more a little bit of a lot of things, not a whole lot of any one thing, but hitting all, driving on all cylinders. I think those are the different ones. And like you said, peptides are stacked a lot. And so being with someone who's well-versed, who knows how to stack them, I think is important as well, because then you can, okay, I want to lose fat, but I want to gain muscle. What do I do here? Well, you can't stack all of them because then you'll really start driving one pathway too much. Yeah. And that's when you might cycle and do, Tesmorelin for a month or two, take 4 weeks off, and then do ipamorelin. And you're like, what am I targeting? What is my goal?
Well, I think
now?
the question is, what is your goal?
Yeah.
And so again, peptides are not quick fixes. You do have to cycle them. It will take a little bit of time to see benefits. Like you may feel something great in the first month, but really you need to complete that second month in most cases. Not all, but most. And so I think what is your goal? Is your goal, I want to feel stronger. I want to build muscle. So to have that conversation.
Yeah.
And not just be picking and choosing.
As you say that, it just makes me think too, I think it's really important for people to also know that there are things that you need to put in. An optimized body is going to do well with peptides. And so you need to make sure you're getting enough protein. You need to make sure ribose and essential amino acids are on board, because that's going to help these peptides to work better and be optimal. And so we're also, going to make some suggestions for you on what you should be doing as part of your lifestyle so that you're getting the bang for the buck, literal, because these things aren't
expensive.
They're not cheap. And you want to make sure that they're doing what they're supposed to do. Yeah. And sometimes when they're not, it might be that you're getting it off of some weird black marketplace and it's not what you think it is. But it may also be that you're just not optimizing your body. We also, we have a stack of ipamorelin and sermorelin. So it's a little muscle building, but also just that, let's take care of all of it in the human growth pathway, human growth hormone. So I think that the human growth hormones are really important peptides.
And they do require labs.
And
so just don't be ordering off the internet.
And monitoring and cycling are really important.
Yep.
Yeah.
Okay. So these are the ones that patients actually are asking for, we're starting to hear. And that is the Glow Stack and the Wolverine Stack.
And these are great peptides, but I also think you call something cute, and that helps too.
Remember,
because who's going to come in and go ipamorelin and am I saying it right?
Yeah.
We needed to come up with a better phrase for some of these. But so the Wolverine stack is and like we said, you can stack peptides. So some of them have stack in the name. Some of them are multiple peptides together, but it's not called a stack. But the Wolverine stack is BPC 157, body protective compound is what that stands for, right?
Yes.
So BPC 157 does a great job of physiologically acting in tissue, helping things to heal correctly. If you have an injury where you say, like my injury is my cartwheel elbow.
I know. I love this story.
Yeah. So at age 51, I was in a cartwheel contest, and I was sure I could do 5 cartwheels. As it works out, my max was 4.5. I hyperextended my elbow, and then
she had to do a whole situation.
Oh my gosh, I ended up having to see my orthopedic surgeon friend who may have laughed at me and it forbid me from doing cartwheels ever again. I had to get an MRI. And that's 3 years ago now. And I am proud to say, with great discipline, I have done no more cartwheels. However, my elbow is still jacked. And so why is my elbow still jacked? Because the tissue did not heal correctly, the tendons and ligaments and I ended up just having tendon and ligament damage. But when new fibrocytes come in and fibroblasts come in and they're trying to lay down new collagen and fibrin and build tissue, if they don't do it right, you forever, instead of everything being lined up and parallel, you have stuff that's going in all different directions. And every time you do something wrong, it re-tears. And so that ankle that didn't heal right, that knee, that elbow, you can have lifelong issues.
And that's
with
how
these
you hold your
things.
computer at work.
Yes.
And so every day, I'm sure it's bothering you.
And carrying bags and whatever else. And so I will get these constant recurrent flares. And the idea of BPC 157 is it actually targets the tissue that's healing and it makes the tissue lay down correctly so that it heals right. So a lot of people will use these post-operatively so that their tissue heals correctly. People will use these when they have athletic injuries like a knee, an elbow, when their athleticism is cartwheels and they blow out their elbow. So these are the areas that BPC works really well because it really helps tell your tissue how to model itself correctly and heal right the first time. And then when we stack this in the Wolverine stack with TB500, TB500 is a fragment. It is fewer amino acids than thymosin beta 4. And so thymosin beta 4 is more of kind of works in the immune system and it comes from the thymus gland. But when we take a piece of that as TB500 and we put it together with the BPC, then it brings more blood flow to the area. It brings more white blood cells. It does a lot of different things that also help with tissue healing and tissue regeneration. And both of these things work as anti-inflammatories. And so sometimes it's a specific injury that you want to heal. Sometimes it's general inflammation, like our autoimmune patients or people like menopausal, postmenopausal, where it's like, I didn't feel every joint in my body and now I do. Or other reasons that, for you, celiac disease.
And it comes orally. So people can take this orally.
And so these two together are called the Wolverine stack. And it's the idea off of the Wolverine character from Marvel that it helps tissue grow and heal and you can't get hurt. Everything will just heal really fast off of the Wolverine concept. But it comes as an injectable, and the injectable I would say is really good for when you have basic injuries, like for my cartwheel elbow. There are some talks as to should you be putting the subcutaneous injection near the site of the injury or just anywhere. I think most of what I have read is that your body's great. Now, if you think about this, these are natural peptides that exist in your body. So your body, your elbow, when it's hurt, doesn't make this. It is made in and circulated in your bloodstream, and it finds the area that it needs to be in. So I think you give all of these sub-Qs in a safe place to give a sub-Q injection, which is your belly or maybe inner thigh, and you don't try to go near the site of the injury. I know a lot of people will say, go near the site of the injury. I think your body's going to target and find where it needs to go. And I don't want people who aren't medical injecting into areas where they don't know the anatomy and they might hit a nerve, they might do some damage, and it's not necessary. It's not necessarily going to help you more. And I certainly wouldn't just give anybody a sub-Q needle and go, hey, throw it towards this bone and see what happens. And so the Wolverine comes as the injectable, but as Amber said, the Wolverine stack comes as an oral as well. Now, as you say, you haven't tried peptides. I would be so interested in you doing a Wolverine oral.
Same.
And the reason that
I complain about my stomach every day.
Yeah, because Amber has celiac disease. And when you have celiac disease, as hard as you try, if you get even the slightest gluten contamination, you get a lot of inflammation in your gut. And so the reason that we would recommend to take this orally as opposed to injection is when you're really trying to act on the gut.
Yeah.
When it's in the gut, it's going to act first and foremost in the gut. And it can help with things like inflammatory bowel disease, with leaky gut, where there's some inflammation and the cells are sort of getting pushed away from each other, so the tight junctions aren't as tight. But a number of other areas where people may have digestive issues. If you're malabsorptive, if every time, no matter what, you eat all fruits and vegetables and you take all your supplements and vitamins, but you're always low on B vitamins and D vitamins, you're probably malabsorptive. It's not getting out of your gut. And I would be interested in seeing if you can fix some of that malabsorptive issue by fixing inflammation in your gut.
I'll have to try it. Okay, so this episode is apparently going to have a part 2. And so we're going to have to wrap this one up.
Just barely got excited
barely.
about our first one. So in our next episode, we're going to talk a little more about inflammation, energy and longevity, and immunity. So stick with us on the next one to learn about some more.
Who knew we had so much to say?
There's a lot of peptides that do a lot of fun things. So come back for some of the other peptides in more detail.
We like to leave you on a good note. So today's Tell Me Something Good is book hype. I love to read, you know this. I've probably had a million Tell Me Something Goods that are all books because that is me. But there was a book called Theo of Golden. Yeah, that's right. Y'all know I'm like questioning my life, but it is Theo of Golden by Levi Allen. And it was all the book hype. I was like, I'm not reading it because it's getting so hyped up. And then I saw the author talk about it and he got tears in his eyes talking about the character that he wrote about. And so I was like, okay, I'm going to get this book. Oh my goodness, it lived up to the hype. It is such a great book. If you have not read it, I highly encourage it. It is about being kind and just living with generosity and with open hands. Such a great book. So that's my today's Tell Me Something Good. Until next time, take care of yourself.